Hi, I'm Tyler Fussell, founder of the Fussell Group. Today I'd like to talk to you about the Medicare Prescription Drug Plan for 2025. But I'd like to start with 2024 to give you a little background. In fact, let's go all the way back to 2022. In 2022, our Congress signed into act the 2022 Inflation Reduction Act. Inside the Inflation Reduction Act was a way to help seniors reduce their cost in prescription drugs. Has a great premise, but as I always like to say, with everything good, there's always a catch somewhere along the way. So just bear with me as I go through this, because as I start to explain what's happening, you may see what I'm talking about. So let's take 2024, the year that we're in right now. Currently, you have a $545 deductible on your Medicare prescription drug plan. You would start by paying your $545 deductible, and then you pay your copays. While you're in that initial phase paying your copays, the actual cost of the drug is what's going to the 5,030 limit. So, for instance, you go to the pharmacy, you pay your deductible, that deductible goes to the 5,030. Then you start paying your copays. You may be paying a $47 copay, you may be paying a $90 copay. All of those copays that you're paying are adding up. In the meantime, what's happening is the actual cost of the drug. I always like to take a drug, say Xarelto. Say this drug, when you go to the pharmacy, the actual cost of it is $1,000. But you're really paying $47 at the pharmacy. But it's that $1,000 that's going to the 5,030, your initial coverage limit. When you reach $5,030 in actual drug cost, that is when you go into what is known as the donut hole, or as I like to refer to it, the abyss. When you go into the donut hole, aka the abyss, you now are paying 25% of the cost of your generic and 25% of the cost of your brand name drug. That is now going towards the new total of $8,000. Now, many people think all the senior has to do is reach the gap between the 5,030 and 8,000. That is not true. That $5,030 that you have now reached in your initial coverage phase now goes away. Push it away. Now you must reach a new total of $8,000. To reach that $8,000, you're going to pay 25% of the cost of the brand name drug, 25% of the cost of the generic drug, plus 70% of the manufacturer's cost of the drug goes towards the $8,000, in addition to, remember I said to hold on to those copays you were paying? That total number that you're paying in copays, whoop, right on into the $8,000. That's right. The copays that you paid in your initial coverage phase, plus the 25% of brand name, the 25% of generic, and the 70% of what the manufacturer is paying goes into the $8,000. Once that $8,000 total is reached, you no longer have a copay at the pharmacy until January of 2025. Now, let's move forward to 2025. For the coming year, Medicare has two plans for prescription drugs. There is the standard version and there's the enhanced version. Let's take the standard version to begin with. The standard version will have a $590 deductible. You will then pay 25% of the cost of the drug to reach a $2,000 out of pocket. That will be your maximum for 2025. So for instance, you go to the pharmacy. You're going to pay your $590 deductible, plus you would pay 25% of the cost of the drug. Both of those totals will go towards the $2,000. So let's do simple math. $590 deductible plus $1,000 actual cost of the drug times 25% is $250. So $590 plus your $250 copay equals $840. That $840 that you're spending in January now goes to the $2,000. In February, you've met that deductible. You're simply going to pay 25% of the cost of the drug. Again, for a $1,000 drug, that is now $250. That $250 is going to the $2,000. So by the end of June, you should have reached your $2,000 out of pocket. What happens July through December? You won't have a copay. Now, let's take the enhanced version. The enhanced version is what you will find in many of your Medicare Advantage plans, as well as some of your higher priced standalone drug plans that have premiums, higher premiums. The enhanced version says you don't have a deductible, or you may have a lower deductible. For examples, we're going to use a zero deductible. So you go to the pharmacy, same medication, it's $1,000. Actual cost of the drug is $1,000. But your portion in January is $47. You're going to pay your $47 copay while 25% of the cost of that $1,000 drug, so $250, is going to the $2,000. You go to the pharmacy again in February. You're paying $47. But the $250, which is 25% of the cost of the drug, is going to the $2,000. You would continue to do that through roughly July and August, and then you would not have a copay for the remainder of the year. That is how the new prescription drug plan works. Now, you're asking, well, who is paying the actual cost of the drug since I am not? That, my friends, is your carrier. That would be your Medicare Advantage plan carrier or your prescription drug plan carrier. So while I started off our conversation saying, this sounds great for the senior for 2025, do be cautious of what may happen in 2026 because your health plans are now having to eat the cost of your medication. They will now eat 60% of that cost. So, best of luck for 2025. I hope you enjoy our example. If you have questions about the prescription drug plan, please feel free to reach out to us at the Fussell Group. You can reach us on our website at www.fgiala.com, or you can reach us through social media. We're on Facebook, we're on LinkedIn, we're also on Instagram, and of course you can always reach us here at the office at 985-875-7407. Thank you, and have a great 2025.
Thanks for watching. This has been a Fussell Group Insurance Advisors educational production series. If you enjoyed this video, like and subscribe and stay on the lookout for more. Please follow us on Facebook, Instagram, and visit our website, fgiala.com.